this year in ASCO 2020 virtual meeting, it was really an unprecedented year for the field of geriatric oncology. What we saw in the oral session this year was that there was 4 randomized controlled trials looking at the impact of potentially geriatric assessment and geriatric assessment-driven interventions on key outcomes that are associated for older adults as they go through cancer treatment. So for example, here at City of Hope, we presented our large, over 600 patient randomized control trial assessing whether or not patients can benefit from geriatric assessment-driven interventions versus standard of care. So in this study, as I mentioned, we enrolled older adults who were 65 years or older with any type of solid tumor malignancy and starting a new chemotherapy regimen. And they were randomized in a 2-to-1 fashion to receive geriatric assessment-driven interventions versus standard of care. So for those patients that were randomized to geriatric assessment-driven interventions, essentially they completed a geriatric assessment questionnaire, and based off of that questionnaire, a multidisciplinary team met to identify key areas of vulnerabilities, such as functional decline, nutrition, cognition, polypharmacy, and then they recommended certain types of interventions which might be able to help the patient, such as physical therapy, nutrition consultation, occupational therapy, reviewing their medications and adjusting their medications. And the overall goal of the study was to see if you provide these geriatric assessment-driven interventions, whether or not it could potentially decrease toxicity for those older adults that are undergoing chemotherapy. And I'm happy to say that the study met its primary endpoint. There was overall a 10% reduction in grade 3 to 5 chemotherapy-related toxicity for those patients that were randomized to the geriatric assessment-driven intervention arm versus those patients that just got standard of care. So this really shows us that if we perform a geriatric assessment and now we intervene on the vulnerabilities, not only are we able to potentially predict the risk of toxicity, but we're actually able to decrease the toxicity that these patients are encountering. And again, I think this is absolutely paramount to our older adults with cancer because, again, as they are going through cancer treatment, it's not only the efficacy that we should be focused about, but we should make sure that these older adults are really able to tolerate their treatment and are able to maintain their overall quality of life.